It was the morning we're all commuting into work. And then there is this manhunt afterward. I think there's a good sense of the motive, but we could learn more. It could be a red herring. But I, too, was so disturbed. I saw some prominent figures on the far left who were celebrating this. And we have lost our collective conscience.
How do you know that?
Because it's online. I'm not even going to amplify and say democracy. Organize, activate, get out and talk to people, talk to your congressman. Violence is absolutely never the answer. And to single out one individual because you have an issue with a company, a corporation, or an entire industry that's been fraught for decades.
And I would add, don't vote for Republicans because they want to overthrow Obamacare.
That's exactly
right. No interest at all.
Respectfully, we complain about our health care right now. We are living under Obamacare. Obamacare ain't perfect either.
Healthcare. My fear also when I was reading about this story is that, you know, we're going to have RFK Jr. responsible for Health and Human Services, who has a brain worm, but he's also, it's not just the brain worm.
Wait, legal note, I think the worm is gone now.
No, I think it got encapsulated in his brain. I went down a rabbit hole on that. But what,
a wormhole, if you will.
Yeah, a wormhole, if you will. What I'm nervous about is if you read Project 2025, which is probably going to be the plan for healthcare, it's about privatization. It's about sort of getting rid of the at least limited amount of sort of universal healthcare that we have. And RFK Jr. really is more into holistic things. So I wonder, you know, if you don't believe in conventional medicine, what kind of medical system are we going to have? If you're angry at what's happening now, I'm nervous.
If you wanted to make it seem like you were angry at an executive for the industry he's in, you would write those things on a bullet. And I think part of the reason that we're so riveted by it, I've been riveted, is because it's New York, right, where there's all of this surveillance. I mean,
18,000.
He could have easily been killed in his home in Minnesota, and nobody would be paying attention. Yesterday, Blue Cross Blue Shield, which had announced that they were going to only cover anesthesia for X amount, and if the operation went overtime, they were not going to cover it. So let's say you were having an open heart surgery, and instead of it being for 4 hours, it was 6. They were going to cut off paying for anesthesia after 4 hours, which is ghoulish. They reversed course on that announcement that they had made. So I think this has definitely shined a light on our health crisis, on the fact that we pay so much and get so little. It's not just the elderly, it's children who don't get approved for seizure medications. The elderly
just for this particular
children who don't get, no, it's actually there was
It's even bigger?
There's a lot of things online, parents online who have said, my kid couldn't get approved for this chemo, or my kid couldn't get approved for this seizure medication. So I think there's a lot of frustration in this country. And, you know, we have to have a national conversation. I think, if anything, it should bring that home to all of us.
Just on Tuesday, Representative Richard McCormick, a Republican from Georgia, said that hard decisions will need to be made on Social Security, Medicare, and Medicaid. There's hundreds of billions of dollars to be saved. We just have to have the stomach to take those challenges on.
Well, let's start with his.
I think that a lot of these people who voted for Trump and the Republican Party did not realize this was going to happen.
I do want to push back on that. I don't know who that representative is.
Richard McCormick from Georgia.
No, she don't know who he is.
You don't know him personally. I do.
I actually think that most mainstream Republicans are raising alarm bells about the fact that Social Security will be bankrupt in 10 years if we don't have reforms. We've all paid into it. It is ours. It is not the government's. We own our Social Security. That's what it is. There are some really out there far-righters who are like, slash it, we don't need it. It's entitled.
Project 2025
but Trump is not going to end Social Security. He said that repeatedly on the campaign trail.
Hope you're right.
You can't believe anything he says.
He's not going to. He cares about the market. If the market crashes because we ended Social Security, Donald Trump's not going to end Social Security. But Republicans have talked about health savings accounts, which I think are a huge step the right direction. As a child, you should get a tax-deductible ability to just save as much for your kids going into it. But we do have a broken healthcare system.
We have that.
What I wanted to say before I responded to that was this isn't just about the healthcare industry. There could be a copycat effect to any major CEO, to public personalities that people see, and they feel like they want to express their discontent. You express your discontent with words, with actions, with organizing, never with violence.
Of what we're talking about here. Things like, unfortunately, my condolences are out of network. Prior authorization is required for thoughts and prayers. I can't even pretend to care. I hope he's looking up at us. When you make millions off the suffering of others, don't expect sympathy. This needs to be the new norm. Eat the rich. I've seen dying patients get denied by insurance. Makes me physically sick. I just can't feel sympathy for him because of all those patients and their families.
Yeah.
I think the thing I struggle with here is people are viscerally angry about insurance. And you can pull up the statistics. Percentage of people in a Gallup poll, quality of health care coverage is excellent or good, 28%. Had any problem with their insurance in the last year? 58% said they did. Insurance didn't cover or required a very high copay for a prescribed drug that people had to take. Significant portion of people. The denial claims with the company that this CEO ran, high.
Well, a lot of this is about grievance, right?
Right.
We have a healthcare system that many people say is broken, an insurance system that many people feel that they're being ripped off. So I think a lot of what we're seeing here is a pure psychological projection against this CEO who is now deceased. And in many ways, we're talking about not just grievance, but people feeling disaffected, disillusioned, angry, not just with the insurance companies, but this is about a class war, a culture war, people feeling now they are justified in expressing.
Wesley William Parker out of breath, but that wasn't always true. An accomplished high school wrestler, he was 7th in the state last year, but during a match sophomore year, he suffered a serious nose injury, an injury that required surgery, but he said his insurance company, UnitedHealthcare, would not cover all of it.
And most of it had to have been paid out of pocket, and it was like thousands of dollars, and I had to say no to the surgery amongst, so now I just kind of have to live with it, and I'm just dealing with it now.
He's not alone. UnitedHealthcare's denial rate, according to the federal government, is at 33%. Blue Cross, Aetna, and Cigna's rate is about 10% lower. And the targeted murder of UnitedHealthcare CEO Brian Thompson has unleashed a social media wave of grievances.
If you think that I didn't need anesthesia to have surgery,
we're fighting with the insurance company over her dialysis to keep her alive.
People are upset, people do bad things, and that's just, almost in a way a form of protest even.
UnitedHealthcare is huge in Florida. 3.1 million people covered, including Medicare and Medicaid. 247 hospitals, over 100,000 doctors. Complicating the crime, Thompson was under investigation for insider trading. The city of Hollywood's Firefighters Pension Fund is part of a class action lawsuit against Thompson and UnitedHealthcare to recover money lost when the stock fell.
As far as we know, no relationship to any of the sad news out of New York.